Hello, everyone. Welcome back. We're going to be discussing Chapter 4, covering infectious diseases. This gets into inserting central lines, ports, whatnot. We don't normally, or some of you may not think of infectious disease as having procedures like orthopedics or general surgery or some of the other types of procedures that are done in the hospital setting, but there are actually quite a lot of them if you think about it. So if you would do, please grab your PCS codebook and let's take a look starting around I'm sorry, not chapter, slide 55. Okay, and again, as discussed, these are looking at procedure codes. We talked in HIM 270 about coding infectious diseases. These are the procedures that relate to treating these diseases in the inpatient setting. And again, these codes only apply in the inpatient setting. We'll focus on the procedures. And a major theme that you'll see is vascular access to deliver long-term antibiotics. So again, sometimes you see these referred to as PICC lines, which stands for peripherally inserted central catheter, and they typically go through the right internal jugular vein. And so you can see here, again, we talked about the 7 characters. We got 1, 2, 3. That will be the table. And then the rest of it will be what we figure out in the table. Okay, so we have the central line through PICC line that goes to the right internal jugular with the catheter tip into the superior vena cava, 0HV33Z. So follow that code along in your PCS code book. And again, many patients with serious infections require prolonged IV antibiotics. And to deliver these medications safely, we use central venous catheters, such as a PICC line, sometimes referred to as a central line, right? In this example, the catheter is inserted into the superior vena cava through a percutaneous approach, right? So again, as we talked about before, remember how we talked about the 7 characters, right? Here are the ones in the table. And then 4 through 7, we deal with in the table, right? Once we find the right table, focus on 4 through 7. So then here's what it looks like, right? If you have your code book, hopefully you're in the right place here. Medical, surgical, heart, great vessels, and section, right? Body part in this case will be V, superior vena cava. It's going to be open percutaneous. And what type of device is it? It's an infusion device, and there's no qualifier. And those are our 7 characters. So in some ways, once you understand the approach, the qualifiers, the device, it's most people can find the table. It's just a matter of narrowing down those other 4. And again, when we're looking at the table, characters 4 through 7 have to be in the same row as the table. Right. So again, here it's totally implantable central venous access devices known as portacaths, right? So if you see portacath, that's what they're talking about. These are implanted in the chest, subcutaneous tissue, and the catheter is inserted into the superior vena cava. This requires 2 devices, therefore 2 codes. One for the implantable infusion device, which is 0JH60XZ, and one for the central line catheter, 02HB33Z. right? So again, PCS codes, one device per code, right? So we use two codes here. And again, one for the insertion of the implantable infusion port, and the second one captures the insertion of the central venous catheter, right? And this is a place that you want to pay special attention to. If you're unclear on what something like a portacath is in terms of a procedure, Google it, use AI, what have you, and it will describe what they are and how they're placed. And sometimes you can even YouTube's a great resource as well. Right. Well, if we're going to put them in, sometimes we have to take them out. So when these devices are removed, if we have two devices, we have two removal codes. The root operation will be, of course, removal, taking out a device from a body part. The index is going to direct you separately to removal from subcutaneous tissue and removal from the great vessel. So make sure you always review the operative report carefully to confirm what was actually removed. Just don't give it the global once over. Oh, we're back. All right. I hope you found that useful. Please reach out if you have any questions, of course. So again, make sure you understand two things. You have to understand what procedures like portacaths are. If you're not, look it up. There are all kinds of resources for you that didn't exist when I was learning this. So definitely a lot of resources out there for you. And then secondly, read the operative record, also known as the procedure note, to make sure you're getting exactly what was done. That's all I have for you. We'll see you online. Bye now.